Well, good afternoon, everyone. As we get ready to receive the first shipments of the COVID-19 vaccines, I'm glad to see news today from the federal government, as I've been pushing it on the Premier's table, that these vaccines have to be distributed and allocated based on per capita, and I'm glad we're doing that. Our top priority remains getting the vaccines out to those who need them most as quickly as possible. Our first shipments of a very small number of doses could arrive as early as next week. But we're still very far, and I got to repeat that, very far from having the millions of vaccines we need for mass immunization. The federal government, as I've said in the past, the federal government, they're responsible for what type of vaccines we're getting, how much we're getting, and when we're getting it. Ontario, I can tell you, with the leadership of General Hillier and both ministers, done an incredible job. And I know you just started, General, but man, did you get off to a great start. Ontario is ready to do their part. And we'll be ready, as we are now, to receive and distribute the first the batch of vaccines when they arrive on our doorstep. And I have to tell you, there's been so much work that's been done. I've seen the work. I've seen both ministers working on it. We had our first meeting on Friday, had another meeting over the weekend, and another meeting today with Cabinet, and we're ready. So I want to thank both ministers for all the work you've done in the past, and General Hillier, again, thank you. And I also want to thank the task force. When we sat down on Friday and I looked at the talent around the table, I was just amazed. We have such great, talented people, as I've always said here in Ontario, and I have 100% confidence we're going to get the job done. I'll hand it over to General Hillier.
Mr. Premier and Ministers, thank you. And ladies and gentlemen, good afternoon. And the Premier asked me to come here and run an operation with the task force vaccination rollout for Ontario. And one of the things I've learned about operations over these past years in the Canadian Armed Forces is that when you have an immense mission like we have with the vaccination rollout program for Ontario, you take it one bite at a time. You can't eat a whole animal at one time or a whole meal and digest it all. So we are doing exactly that. Our mission is really clear for us. We want to run an efficient and equitable COVID-19 vaccination program for Ontario in order to provide every eligible person in the province with the opportunity to voluntarily get vaccinated against COVID-19. And we believe that's going to go a huge way to helping end the tragedy that we see around us all the time in our normal lives and allow us to get back to whatever perhaps a new normal is going to be. And that's our mission, that efficient and equitable COVID-19 vaccination program for Ontario in order that every eligible person in the province can voluntarily receive a vaccine. We've broken it down into three phases. Phase one is really, in the military we always say, shoot the 25-meter targets first. Shoot the ones in close. Get at the things that are going to be right in front of you right away. In our phase one, we want to deal with the vaccines that we know are coming in the first quarter of 2021. So even though we don't specifically tie it to that first quarter, it's very close there. We know we're getting 2.4 million vaccines in that first quarter, as was, I think, announced by the Minister of Health before. And we know that they'll come throughout that quarter, but we don't know the exact dates. That allows us to do 1.2 million people in Ontario from those who are eligible. And based on the direction that we've received from the government, from Cabinet, we want to get at the most vulnerable population and then get at the health workers across Ontario who really are vulnerable just in a different way. And in some cases, those two priorities are going to mesh somewhat because, for example, when we go at the most vulnerable and we go into a long-term care facility to look after the residents there who have suffered so badly from this horrible epidemic, we are obviously not just going to do the residents that are there with a vaccination program. We're going to have available for the people who work there, the personal care workers, the health care workers, and those essential visitors that are required to look after the people in those homes also. So in our phase one, We want to get the vulnerable and the healthcare workers, and we know that we will have more demand in those two groups than we will have vaccines to satisfy. So we can't do it all at once, and what we have committed back to the Premier and to Cabinet is that our decisions in the short term, based on when the vaccines arrive, whether it's 100,000 next week or 250,000 down the road further on or 500,000 2 weeks after that, we will make the decisions as to where we go based on the best data that we have. So we will go, for example, towards the people in long-term care homes who are in the hot zones, who are in the lockdown zones, who are in the red zones. And we will go for places where there's congregate living, where there is communal dining, where there is more than one person sharing a room. And we'll go into places where they've had problems with COVID-19 and suffered tragically from it before, and we'll go into places where the Government of Ontario has had to offer their support in the past 9 months or so to make sure that the tragedy doesn't get even greater. And so we're going to do that over that first phase. And we're going to start, we've been working hard to do the planning, pulling together all the incredible work that's been done from the logistics people, from the medical folks, from the information technology folks, and of course for the public communication specialists who are working on how to educate the public as best possible about what the program is and what the vaccine is so they can make intelligent decisions on what they need to do to live a better life going forward from here. And so we've been doing that planning. We've already run one tabletop exercise to look at how we would do things. We will run more. We have participated in 2 tabletop exercises with PAC to ensure that we are in lockstep with them. We have coordinated with the Canadian Armed Forces, 4th Division headquarters here in Toronto, and the staff there are into our planning with us, and we are working through that. We are making sure that we're ready to execute on Phase 1. Phase 1 will take us 2 to 3 months, depending on the arrival of those vaccines. We won't be able to do everyone each day or on the first day, so people...
How can you prepare for extreme cold? In Alberta, extreme cold warnings are issued when the temperature is